So,
my name is Cassandra Nichols, and I am in the LPN 154 class. Today, I will be doing a video on administering medication. I will be doing an oral medication, IM injection, and a subcutaneous injection. Before I do anything, I will go into the medication room. I will make sure the door is closed behind me, and I will make sure that I have no distractions. I would review the doctor's order for the medications to make sure that everything's correct. I will review the patient's allergies to make sure that the medication ordered on the MAR does not contraindicate with anything that the patient is allergic to. I would also make sure that the dosages are correct, and I would also use the patient's 7 rights as far as administering to my patient, making sure that it's the right time, making sure that everything is right time, right dose, right route, right indication, right drug, right patient, and using the right documentation. So first, I will prepare my patient's oral medication. I will check the MAR to make sure that everything is the same on the physician's order, and what we have available, which we do, is Synthroid 100 mcgs. I would check again the MAR just to verify that everything's correct and verify that I'm looking at the correct patient's order. Once I see that everything's correct, I'll open it and place it in the patient's medication cup. There's no need for me to crush or cut in half for the patient because the patient has no difficulty swallowing anything. Then I would also look into the order, the MAR, and I see that the doctor also ordered an insulin injection for my patient. I would first check the MAR order to make sure that everything's correct as far as the dosing. I would pull my medications needed, check expiration dates as I will with all my medications. I would make sure that everything coincides with what's ordered from the physician, and make sure that the dosaging is correct. Nothing looks abnormal. I would then take my medication, and I would perform hand hygiene, and I will put on my gloves while preparing medication because I don't want to contaminate anything. And also, I'm doing all this in the medication room. I'm not even technically in the patient's room yet. I would gather all my supplies, which I have. I would clean off the vials. I will get my insulin needle, and I also will check the MAR again. The physician has ordered 10 units of insulin. He wants 5 units of the NPH and 5 of the regular. I will take my insulin needle, and I will pull it back to 10. I will inject this into the vial of the NPH first. I will draw up 5. Make sure there aren't any air bubbles. And also with insulin, I would have another nurse come in and verify that everything's correct as well. So I have 5 of the NPH. Take that out. I would get the other 5 of my regular insulin. I would not inject air because I have the other insulin in here and I don't want to contaminate the vial. So I will slowly get my other 5 units out of here, trying to go as slowly as I can so that I don't go under or over the desired dose. So I took the 5 out, cut this. I will have a nurse verify that it is indeed 10 units altogether, and then I will label this with the patient's information to make sure that nothing gets lost or misplaced or given to the wrong patient or anything like that. So that will be my sub-Q injection. Next, also the doctor wants me to give the patient, let's see, 0.5 60 milligrams of the Toradol for my patient, and I'm going to insert that IM. My patient, I'm going to take off these gloves, perform hand hygiene, and put on more gloves. I'm going to clean off the vial. I'm going to refer back to my MAR, make sure that the dosing is correct and what the doctor is wanting me to give the patient is correct, and I'm on the right patient that I'm trying to give this to. I will verify that 3 times just to make sure that there's no error, and I will also make sure that with everything that I'm doing, I am making sure that I'm aware of the patient's several rights, which I stated in the beginning of the video. My patient is a smaller patient, so I'm using a shorter needle because my patient's very thin. So I'm using my judgment to know that I don't need to get a very big needle. So I'm going to give this patient 0.5 because that's what the doctor ordered. Since this is a multi-vial, I will inject ER first. So that it doesn't a lot of pressure. Okay. So I have my 0.5 that was ordered by the physician. I'm gonna cut this up. I'm going to label this as well to make sure that nothing gets misplaced or given to the wrong patient. After drawing up medications for my vials, I would replace them back in the Pyxis and make sure that I enter everything correctly so that inventory doesn't get messed up. I would throw away my garbage. I'll take off my gloves, perform hand hygiene, and then I'll proceed to my patient. So, going into the room with my patient, I will bring my medications. I will knock on the door. I will perform hand hygiene. I will introduce myself, perform hand hygiene, put on my gloves. I would verify that my patient is who they're supposed to be, so that I am administering medication to the correct patient. So I will look at the armband, and I will ask for patient to verbalize their name and date of birth. My patient is who they're supposed to be. I will also verify any allergies that they have that may not be listed, because I don't want to give my patient the wrong thing and they have an allergic reaction. So first, I will inform the patient that I am, the doctor has ordered Synthroid for them, 100 mcgs, 1 tablet orally. I would also confirm again that my patient has no problem swallowing. I will make sure that my patient is in a comfortable position. I will give my patient a glass of water and give them their medication. Make sure that they're okay with taking it and give them their medication so that they can take. So after the oral medication, I would inform my patient that the doctor also ordered their insulin. After checking their blood sugar and making sure that it's at a level that it needs to be for them to get the insulin, I'll confirm that it's okay and that I will give my patient their insulin. Insulin is a subcutaneous injection, which can be given in the abdomen, I believe the upper arms up here, and also the vastus lateralis, I think it's called, and which is on their thighs, their outer thighs. So, I won't inject my patient. I will demonstrate on here. So, as if this was the patient, and I will be giving the medication on their abdomen. I will review the chart again, make sure everything's correct with the order, the patient name, make sure everything is correct, and I will also check this, ask the patient, check to see where's the last place they were injected, because I kind of want to alternate so that kind of helps the area, you know, heal or whatever. So I would clean out that area. I wouldn't blow the area dry. I wouldn't fan it because I don't want to contaminate the area. I will let it air dry. Then, since this is a subcutaneous injection, I will take my insulin, which is labeled with the patient information, so that's how I'll know which one it is. I will uncap it. After it has dried, I would pinch up the fat. I would inject like that. I would, I'm not going to inject inside the little fatty skin we have, but I would inject the entire units inside of the area on the abdomen. Well, actually, I would poke it in, let go, and inject. Then I will draw out. There's no bleeding, so I don't have to put a Band-Aid or anything like that. I will just make sure that the area is absorbed correctly. So I will just place a gauze on the area and just hold it down a little bit. That's it. I will throw that away. I will put my needle in the sharps. I want to recap, but for the video purposes, I'm going to recap this, but cup it for safety reasons. But I would put this in the sharps container. So I would ask the patient if they're okay. I will also come back and reassess them about 15 minutes after I've given them all the medication, just to make sure they're still okay. So after administering the insulin, I would take off my gloves, perform hand hygiene, and then I will inform my patient that I have one more injection that I have to give them. The doctor has ordered Toradol 0.5 ml. I inform my patient of that. I check the MAR just to reconfirm that everything's still correct. Make sure I have the correct patient. And this injection I am going to give IM, but I am going to give this on my patient in the ventricular area. So, which will be, this is my patient. I'm going to place my hand on their gluteus with my finger pointing toward their groin area. The area in this, my big V, is the area where I will be administering the injection. And as you press down, you will see, you'll be able to get down here in the opening. So I'm not going to inject into the mannequin, but I wanted to show where that area will be. So just as if this was the area, I would clean my site. And this medicine is going inside the muscle, so you don't have to squeeze, because when you squeeze it for the sub, it's like with the sub-Q, I want it to go into the fat. So that's why I squeezed it, so that it can go into the fat. So I will uncap it. My patient is a smaller patient, so that's why I'm using a smaller needle. If this patient was a larger patient, then I would use about maybe a 1-inch needle. So that same area, I will go in just like that, inject my medicine. You know, I will take about 2 to 3 seconds to inject every meal, but you know, you don't want to rush the medication in, because you want it to have time to absorb in the muscle in the body. So after injecting, I will pull out, apply my gauze. There's no bleeding on my patient, so that would be it. I would, in the real world, I would place my syringe in the sharps container, gather all my garbage and dispose of it, I would document everything after leaving the room, come back about 15 to 30 minutes later to reassess my patient to make sure that they're doing okay. And I would document if there was any allergic reactions or anything like that. Before leaving the room, I'll ask my patient if they had any questions. I'll make sure I answer any questions that the patient has, inform them of any side effects that may happen. I would lower them to the lowest setting in their bed, make sure their call light is within reach, thank them, and that'll be all.